Welcome to This Explainer. Look, if you're a clinician, a medical coder, or a clinical documentation integrity specialist, you already know that charting can often feel like this endless, grueling administrative chore. But today, we're going to fundamentally shift your mindset. We're going to completely transform how you view your documentation, taking it from a daily burden and turning it into a vital dual-purpose shield that actually protects both your patients and your own professional livelihood. So let's just jump right in with a pretty provocative question about the true audience for those charts you write every single day. When you type up a history and physical, or you finally sign off on that progress note, who exactly are you talking to? You might think you're just leaving a quick breadcrumb trail for yourself, or maybe for the physician taking over the next shift. But the reality of your audience is much, much broader than that, and the stakes, well, they're incredibly high. You know the drill. You spend hours staring at an electronic medical record system, focused entirely on the immediate, fast-paced clinical reality of your patient. You're managing alerts, you're tracking lab results, and you're making rapid-fire, real-time decisions. In that moment, the EMR is just your digital workspace where you are actively practicing medicine. But here's where we need a major paradigm shift. Your medical record actually lives in two completely different realities. Yes, it serves a critical medical purpose, absolutely, but it also serves an equally critical legal purpose. And here is the kicker. These two purposes are evaluated by entirely different sets of rules, they're read by completely different people, and they are scrutinized for very, very different reasons. Now, in its primary medical function, the record acts as a lifeline among your colleagues. It's the central hub, the common storehouse for all the vital information about a patient's condition. And it's there to ensure that no matter who happens to be on shift, the patient is going to receive seamless, continuous, and above all, safe care. And that medical purpose is tailored directly to your primary audience, which is your direct patient care team. These are the folks who speak your clinical language. They share your exact immediate goal of treating the patient, and they're reading your notes in real time to actually execute a care plan. When you document, this is the audience you usually have in the back of your mind. But then we hit this absolutely wild statistic, 2 to 7. That number represents the typical 2 to 7 year lapse between a clinical event actually occurring and sudden litigation arising. That is a massive time gap. It means that the note you're hurriedly writing today, right in between seeing patients, might not face its ultimate test until literally half a decade from now. So be honest with yourself for a second. Is there any chance you are going to remember the subtle nuances of one single patient encounter half a decade from now? Think about how many patients you see in a single week, let alone a month or a year. If you're called in to give a sworn account of why you diagnosed a patient with a specific condition 6 years ago, your memory is going to be absolutely blank. Human memory fades, right? So whatever you documented today literally transforms into the absolute sole legal truth of that encounter in the future. In the eyes of the law, and especially in the eyes of auditors, the medical record is the only detailed, objective account of what actually went down. Honestly, if it's not in the record, you are going to have an incredibly difficult time proving it ever took place at all. And that huge time shift introduces a surprisingly diverse, unseen secondary audience. Suddenly, you have non-clinicians, attorneys, and reviewers functioning in legal or administrative capacities, and they are going to scrutinize every single word you wrote. They aren't reading your notes to treat the patient. They are reading them to determine medical necessity, to establish liability, to approve or deny claims, or just to audit you for compliance. The exam room used to be the strictly confidential arena between provider and patient, but today, this unseen audience has a massive stake in what takes place in there. So in this totally different courtroom or audit reality, the record's legal function really takes center stage. Its purpose is to provide concrete, undeniable evidence that you delivered the appropriate standard of care. It's there to document how the patient responded to your treatments and to clearly explain your clinical rationale. Like, why did you diagnose strep throat and not something way more severe? Your documentation has to answer those exact questions for people who were never even in the room. It's a huge contrast, isn't it? On one hand, you have your everyday clinical collaboration, and on the other, this strict, adversarial legal environment. In your clinical reality, your notes are collaborative and forward-looking, but in the legal reality, they instantly become defensive, retrospective evidence. And if you're a medical coder or a CDI specialist, well, your job is often to bridge this exact gap, ensuring the clinical reality is translated so perfectly that it holds up seamlessly in the legal reality. Which brings us to a pretty harsh verdict on provider credibility. Attorneys, judges, and auditors are going to directly equate the neatness and completeness of your chart with the actual quality of your care. It's just human nature. If a reviewer is reading a record that is full of vague or missing elements, they're naturally going to infer that the medical care you provided was just as sloppy. So look, comprehensive, accurate, and highly specific documentation is not just some burden you have to suffer through. It is literally the definitive proof of your professional competence. It's how you establish your credibility to an audience that has never even met you. When a chart is thorough and legible, it speaks for you. It confidently says, I was attentive, I evaluated the risks, I made sound clinical decisions, and I provided excellent care. The really crucial takeaway here is that a solid, detailed chart acts as a dual-purpose shield. By clearly documenting the subjective history, the objective findings, and a well-reasoned assessment and plan, you're actually doing two things at once. First, you're ensuring your patient gets the absolute best possible continued care. And second, you are proactively defending your entire career against future scrutiny. As we wrap up this explainer, I want you to start looking at the notes you write today through this brand new lens. Just ask yourself, will today's note protect me tomorrow? Will it make sense to an auditor, an attorney, or a jury 5 entire years from now? By mastering the dual identity of the clinical record, you empower yourself, you protect your patients, and you secure your practice. Thank you so much for joining me today, and please like, share, subscribe to Decode Healthcare with Harshul.